What's up, my fans? We are live. We are live. So, I'm actually going to do a breakdown of a lammy tray. Um, get you guys a better understanding of how it works. Uh, I gotta find one first, though. Um, I got a mini hand, total A, total B, but somebody got to open SPM for me so I could do this tray. It's been a while. Let me go ask somebody to get me into SPM so I can do one of those trays for you guys so you guys could see what we do in the sterile processing department on a daily basis. I mean, telling you, I'm not in scrubs. I'm in the, what's the name? Angelo, uh, can you open the SPM? I want to do a tray. I want to do a tray. You can open SPM? Yeah.
What do you mean?
I want to do a tray.
A tray with my name?
Huh?
Ah,
What'd you say?
you want to do a tray?
Yeah, I'm gonna do a total, a mini hand or a total B.
Oh, you want to practice?
Nah, I want to make it for my viewers and subscribers.
Oh, okay.
Yeah.
I do that for you. I have to trust you. Otherwise, I'll call you guy. Look, guys. Yeah, that guy, the guy, you know what he did. What do you want to do?
Doesn't matter. I'll go over here.
Yeah. Are you staying there longer?
Yeah, I'm just gonna do that one tray and then I get going.
You see, I wish you were present so you had.
Right? I should have
Yeah,
did per
nah.
diem, but I just end up
Talk
just
to her.
leaving. Yeah, I'm probably gonna talk to her and ask her.
Yeah. I think, you know what? I think you should. Are you recording?
Yeah, I got it up. I'm live. Great. Thanks.
You're
Thanks,
welcome.
Angelo.
You're welcome.
Alright. I gotta get that mini hand.
ER go to CAT scan. Go to CAT scan.
Alright, guys. So, I need a glove, need gloves. Okay. So, alright, let me bring this. Put on this. Shit. That rips. I need a bigger gloves. These keep ripping. So, you guys probably, some of you guys who probably have get an idea to get into a department, stuff might look a little bit different, but that's totally normal. Cause no department is ever the same. Every department do things a little bit different. So, right here, I have a total B tray. I usually do it. I used to can do this tray without the system, but I'm going to do it with the system. Technically, we take everything out. I'm gonna line everything out, and then I'm gonna show you guys um, what I'm looking at. Cause I know the camera is not setting perfectly how it is. So let me give a little easy rundown on how you guys should set it up so it'd be a lot more easier on you guys, especially when you guys are on the really busy and they're waiting on the tray. Let me show you. All right, so we have the pick list, not the pick list, but the. Okay, so let me show you guys. Okay, so I line up everything like objects. You see groups. So it's a lot easier for you, especially when you're going down the list. You could just grab them and go. This tray, I know this tray out of my head. I don't have to use this system in order to do it. I could just do the tray without even going in the computer and doing it. So they want an osteotome. So these right here are the osteotomes. These are osteotomes. The system, they say they want 1, 2, 3, 4, 5, 6, 7, 8 osteotome. They want the straight and 1/4. This is the curve. This is the straight and 1/4. So that's the first thing you're gonna put in the tray. First, some people put tray liners in the tray first and do it, but I do mine a little bit differently. I don't put this hospital. They don't care if you don't put tray liners. Some people throw their indicators in there first, which is a smart thing, so you don't forget it. But I don't do that. But anyway, I'll do it just because. Put your indicators in there first. They want it's always with particularly with a total A. Two of these long. It's always a straight and a curve, and that's the 1/4. Half, which would be this. It's always straight and curved once again. I mean, these always straight and curved. Straight and curve again. Straight and curve. This particular tray, was already done, so I know for a fact everything is clean in there. But when you guys are doing your tray, make sure you guys double check, especially in these places, and then you turn it to the side and make sure there's nothing in here. You know, a lot of people bring this down so they could keep it open, you know, keep it flopping, especially when it's in the autoclave, so it could go, the steam could clean throughout the whole instrument. So I mean, every department is different. Some keep it closed, some keep it open. It depends on where you're at, basically. Osteotome. All right, so after osteotome, I'm gonna check these off. Give me a second. We're gonna use the curette. Let me see how many curettes. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6, 7, 8, 7. So there's 7 curettes in here. Once again, every department is different. Every trays are different. There's 7 curettes. It's straight and curved. I'm gonna give you. So this right here will be a straight curette. I don't know if you guys could see the tip, that it is straight. And this one right here is the curve one. You see a little curve? You see a little curve versus the straight one? Straight and curve. And then you just put them in there. You want to make your tray a little bit neat. I usually try to do it a little bit neat. Don't forget your indicators. Let me check those off. And then your mullets. It's as I said, some trays are different. Some of them have one. This one have two of them. You got a 3-pounder mullet and a 2-pounder mullet. So this and oops, and this. Once again, guys, make sure it's not damaged, no crack or broken or anything like that. Make sure you guys check for any damage. You put it out of service if it's damaged. Make sure there's no excess tissue on it at all. Okay, so I'm at the cob. These are your cobs right here. You got a wide and a narrow cob. So it basically, they usually state have small and large cobs. So this is what it looks like. This is what the cobs look like. Rangers. So this is your ranger, right? It's straight and large ranger. And as I said, hold this 2 sides, press it, open it, and make sure there's nothing in these little creases in here. Usually blood and bones and stuff is stuck in there. You know, you guys make sure it's I already know this was clean because somebody was doing it and they already finished, so I'm just redoing it just for the video. So this right here. Okay, so the other one was a duckbill and it's not in here. So that's like, if the instruments are not in the tray, you're supposed to print out the pick sheet, and then you're supposed to put it in the tray, and then they're supposed to get it. But let me see if I could find a duckbill. Usually it's hard to find. So right here we have like extras instrument, just in case your trays don't have a specific instrument that you're looking for. You're looking in these stuff right here. These are like extras to see if there's like a instrument that you need is there. I'm looking for a duckbill right now, but there's no duckbill. There's no duckbill. So on my sheet, I'm gonna mark it as missing. So I'm gonna put 0 and mark it. As I can see on the screen right here, it said 1. That means I'm missing the Ranger duckbill. I'll put it back right here for you guys. And impactor, bone impactor. So this is what they call the bone impactors. Look for it for any cracks, broken, any damage, any blood, any bone stuck to it, anything like that. Once it's good, put it in the tray. Z retractors. These are your Z retractors. It's kind of self-explanatory. It looked like a Z.